I bet I've seen 5 people today that thumb and these 2 fingers are numb. They have carpal tunnel syndrome. We've talked about this before. About 3 of them are here way too late. They have severe carpal tunnel by NCV and EMG studies. I tell people, let your doctor treat you 4 to 6 weeks and get an NCV and EMG study. You want to have the surgery sooner rather than later. Now, I'm a neurologist. I try to treat people without surgery. Wrist immobilizers, anti-inflammatories, and vitamins in time. But they're not better than 6 to 12 weeks. I send them to the surgeon, get it fixed early. About 3 of these patients are going to have surgery. They won't get well, but it'll keep them getting worse. The other 2 or 3 will get well 95 to 98% of the time. So, that's carpal tunnel syndrome. See a neurologist pretty quick and get an NCV and EMG studies and see how bad it is. Because it'll make a determination whether you need surgery an hour later. Well, this is Dr. Caudle Miller, the Brain Doctor. Like, comment, subscribe. I answer all the comments in just a few days. More later.